Hi there, and welcome to another episode of Real Talk with Dr. Jim Sharps. Great to have you back with us, Dr. Jim. For those that are new to the channel and you're coming across us for the first time, our aim here is to demystify alternative therapies. There's a lot of misinformation on the internet, and we really try and be a trusted source for you to kind of open up your own journey of discovery in terms of how you can be more health empowered, nutrition empowered, and ultimately be more informed about the choices you make in your lifestyle, nutrition, diet, ultimately with the aim of enjoying outrageous health, as Dr. Jim very regularly says. So that's the aim of this channel. We just want to kind of spread good information. We're happy to engage, so do check us out in the comments. Leave your comments if you want to engage. We monitor those very closely, and feel free to engage with us at any of the links and places in the video description. So Dr. Jim, thanks again for joining us. We'll kind of cover this week an area that's kind of front of mind for many different people, and that's kind of cardiovascular challenges. We have spoken many times in various different forums around kind of the causes and contributing factors as opposed to the symptoms. So I really wanted to focus in on that today with a focus on cardiovascular disease. So looking as a kind of first question, Dr. Jim, at symptoms, what are some of the symptoms of cardiovascular disease that you see from an original medicine perspective?
Yeah, so the symptoms of cardiovascular disease. And this is a very important topic. This is the number one thing that people die of. And it's things like, you feel things like chest pain, dizziness, fainting, fluttering in the chest. It could be lightheadedness, near fainting, if you will. You get this sense of loss of balance, racing heartbeats, slower heartbeat, depending upon what phase of the cardiovascular system is being affected, and shortness of breath. Those are some of the major symptoms that people will experience with cardiovascular disease.
And yeah, that's great. And in terms of how one can reduce risk of cardiovascular disease, could you maybe speak to that a little bit more?
Yes, reducing the risk of cardiovascular disease, well, it's clearly one of the easiest things in the world. Is simple, I should say, but not easy. But the answer is basically if just drinking a sufficient amount of water to clear out the system, clear out those blood vessels, proper diet, sunlight, exercise to get the blood flowing. So those are some of the major things that you can do, and they're very simple, very powerful, and very effective.
Great. And in terms of kind of cardiovascular disease and coronary heart disease, I know that it's for some it may be synonymous. What are the differences between the two? Maybe you could kind of expand on the differences a little more for us.
Yes, that's a really good question. The difference between cardiovascular disease and coronary disease, and they are used interchangeable, but there are some slight differences. Coronary disease is a cardiovascular disease, but it's usually more specific. As the term indicates, coronary is more focused on the heart itself and the coronary arteries, if you will. So the blood vessels in the heart itself, whereas cardiovascular is the broad spectrum of the heart and the entire vascular system, the arteries, the veins, the entire blood, cardio and blood vessel system. So coronary is as you noted, it's used interchangeably. There are some slight differences, and people when they're experiencing coronary disease, they have basically the same types of symptoms. So they can be used interchangeably, but technically speaking, the coronary is more specific to the heart itself and the blood vessels of just the heart blood vessels.
Yeah, very clear. Appreciate that. So in terms of, as we always kind of look at how can you address causes and contributing factors before they arise. So in terms of lifestyle changes, what can somebody watching this video do to kind of reduce the occurrence of cardiovascular disease or coronary events or associated symptoms?
Yes, very important question. And lifestyle changes do help quite a bit with cardiovascular issues. And primarily less stress and more rest. And one of the things that stress the most in cardiovascular disease is the gastrointestinal system. It puts a lot of stress on the system, takes up a lot of energy. And so proper diet, exercise, as we noted earlier, meditation, prayer, avoiding those things that contribute to it. Big part of original medicine is not only positive things, but avoiding those things that are harmful. And so, it's an individual thing, and a qualified practitioner will kind of evaluate the individual's diet and lifestyle. And like I said, more rest, less stress, improved diet, more exercise, basically original medicine, those 8 laws of health, fresh air, water, sunlight, nutrition, exercise, proper rest, avoiding those things that are harmful, and then a balanced spiritual, mental, emotional life. Those are the primary lifestyle factors, which are very, very effective for cardiovascular disease, the number 1 killer. And so people will have to find something else to die of if they just honor those simple lifestyle changes.
Yeah, no, clear. And a final question, you mentioned kind of those lifestyle factors or those lifestyle changes. In terms of a very practical, and we're not here to prescribe, that's not the space that we play in, and we want to make that very clear. But from some of those changes, could you maybe kind of expand at a more practical level, perhaps more rest, less stress, some very practical strategies that somebody watching this can start to employ themselves in terms of addressing any kind of cardiovascular issues that they have?
Yes, very, very good question. And so what are some specific things? So for example, trying to get to bed as many hours as is practical before midnight. Every hour before midnight is worth 2 hours after midnight. So going to bed at a proper time. A very important one is not eating heavy meals at the end of the day. Most Americans eat their heaviest meal at the end of the day when they'd be better off having that as their first, or better off their second meal. And so eating a lighter meal. And as you said, we don't treat, but there are some herbs that help quite a bit while you're integrating these lifestyle factors. And 2 of the things that we use quite a bit from a natural health standpoint is something called hawthorn berries, which is a really good herb that basically helps with it's basically an herbal replacement for the medical approaches. They use ACE inhibitors, beta blockers, calcium channel blockers. And hawthorn berries has at least 3 of each of those with none of the side effects. And a lot of times with cardiovascular disease, you have issues with the kidneys. So where they tend to use pharmaceutical diuretics, there are natural diuretics, kidney flushes and herbs in that category. So there are herbs as well as diet and lifestyle factors that you can apply to cardiovascular issues while you're integrating those dietary and lifestyle factors, and so that you can be addressing the symptoms in a less stressful way while you're making those changes.
That's very clear. Dr. Jim, thank you as always. I hope as you've been watching this, it gives you some things to think about. As always, if you do want to continue the conversation, please do check out the links in our video description. I would really strongly recommend joining our online community. It's where we have a lot of these conversations, and we go into a little more detail in that kind of safe space within the community. So I'd really encourage you to join there if you're interested in continuing the conversation. Dr. Jim also has a practice, so if there's kind of specific consultations and specific health challenges that you want to work with, there is a practice as well where Dr. Jim has a roster of clients that he supports very specifically. So thanks again for listening. Hope that's been informative. Until the next time, bye for now.
Bye for now. God bless.